Good morning. Are you the nursing assistant for room 616?
No.
That's interesting. Then why is your name next to this room number on the board at the nurse's station?
'Twas I only covering for the patient's nursing assistant who's on her break. She will be back in an hour and a half.
Okay, then I will need your help. I am the PT for this patient and I need to get her up for her therapy session. I noticed she has had a bowel movement and I need her cleaned before I take her down to the gym. Why hasn't this already been done?
Whatever, yo. 'Cause she musta just did it just now. I just checked her 5 minutes ago.
That's impossible. The feces is dried and caked all over her leg and back, and the odor that is coming from this room suggests that the patient has been lying in her own waste for quite some time now. Not to mention that she is wearing the same gown that she had on when she was admitted 2 weeks ago.
She ain't my patient.
Look, I am willing to assist you by rolling her from side to side while you clean and change her. By doing this, I can assess her bed mobility, command following, trunk stability, and functional knee range of motion, which are all part of her plan of care. In other words, we can help each other complete our job tasks.
Why do y'all be messing with these patients anyway? They're old and need to rest. You guys getting them up out of bed makes more work for us and the nurses. Can't you see how hard we be working?
Are you shitting me? I just saw you sitting in a chair next to the patient's bed with your feet propped up on the bedside table listening to the patient's iPod, while flipping the TV channels back and forth between Univision and BET. Plus, this patient is not old. She is a 51-year-old mail carrier who plays tennis 3 times per week and just ran a 15K race last month. She is here for rehab after having her meniscus repaired in her left knee and plans to resume her prior level of function when she is discharged. She needs her therapy twice per day. If she stays in bed and continues to be sedentary, she is at high risk for developing blood clots, pressure wounds, pneumonia, poor knee range of motion, and muscle atrophy.
That is a lot of stuff she be doing. She needs her rest. Let her stay in bed. This is a nursing home, which means that the nurses make the rules for this home.
Are you serious? Actually, it is a skilled nursing facility, which means that there are some patients that come here for skilled rehabilitation under a physician's order. We have to get a certain number of minutes with these patients in order to make drug categories and ascertain that they get the care they require. If these are not met, the building does not make any money and therefore cannot pay your salary, and the poor outcomes will reflect negatively on the facility and you will be out of a job when Jacko shuts the doors on this place.
I don't care. This patient needs to rest so those sores on her back and heels will get better. Plus, she needs to learn to ring the call bell when she needs to poop or pee. I'm tired of cleaning her up.
She told me that she rang the call bell 13 times and 10 of the times, you came into the room immediately and shut it off, saying that you'd be right back. The other 3 times you made her wait 30 minutes before finally coming in, shutting off the bell and leaving. Plus, she says she hears you talking bad about her and calling her names in Spanish with another nursing assistant when you are in her room pretending to work.
How does she know what we be saying? Her last name is Johnson. How does she know Spanish?
Because she also teaches English as a second language to underprivileged Hispanic children in her spare time. She said your son is one of her students. Now, will you stop wasting more valuable time and help me get this patient up?
She is not my patient. And I have to go on break.